Due to the graphic nature of this program, viewer discretion is advised.
Get them on IV fluid.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.
Hi. He's looking at us. He knows something's happening. These people grab me all the time.
This is Cammie. Cammie is our little chameleon friend who basically is having some problems passing some eggs. So we did a radiograph just to kind of make sure that the eggs are in there, and now we're just doing an ultrasound too to figure out what the eggs look like, where they are, how many there are, and then later on today hopefully we're going in surgically to take them all out.
So actually we're going to, yeah, you see how they change colors? We're just making sure that there are eggs inside of there. You see tons of eggs on the ultrasound right here. And she just stopped eating. She won't eat, she won't, because they're compressing the whole GI tract. And there's so many that she's getting bloated. Normally she reabsorb them. In other words, they don't calcify, so she just her body just reabsorbs them. But now she's got so many that it's causing her to not want to eat and be really sick and lethargic. So we're worried that the owner's going to end up losing her. So we're going to go ahead and spay her, basically take out her ovary and uterus and remove all those eggs. So, but you see she's changing colors. Anytime you touch her, she gets stressed, they'll change colors to their environment. So it's kind of cool. It's not like that commercial that they turn blue and pink and purple like that one commercial. So you got to give it the right forelimb because they have a renal portal system, at least we think they do. Pretty sure they do. So you have to get it in the front leg, either back or front. Go in on the ankle. Do you want to hold? Call her in. Okay. Speed is of the essence. I'm going to make the lidocaine injection. This is for a local block. So she's making her abdominal incision, and you always make it to one side of the abdomen. You never go in right on the most medial part of the body because there's a vein running there. And so you want to make it always to the side of the midline, the midline being this right here. So those are all the eggs in the uterus. A lot of them. Some even just loosen the abdominal cavity because it's tearing, huh?
Yeah.
The owner thought she reabsorbed them, but she probably never did. Having this is ideal, especially if you want to work really fast. We use it in dogs a lot for taking out spleens and liver masses and everything. We'll use the ligature to cut and cauterize. Okay. So we'll get in here. Close the body well. EKG is showing about 145, which is pretty fast for a lizard, but we gave him a really hefty dose of pain medication, so he's not feeling anything. And then we use the local lidocaine. And you try to work as fast as you possibly can because this is a lot for a little lizard body. And she was sick beforehand, so we tried to put her on heat support first. But that's a lot to take out, so now you can understand that this is the ovary, and then these are all the uterus here. All right, now the scales, sutures. It's not the skin sutures. I guess it's skin too.
Yeah. Oh, I'm
right.
sorry, friend.
Is it up?
I'm sorry.
Off and out?
I'm sorry.
All right,
Going right in.
turn. That's an injection of antibiotics. She's moving around already after surgery. Not even people do that.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, Metropolitan Fence, we're always on the level, and Camp Bow Wow, premier doggy day and overnight camps. And now, a word from our sponsors.
Welcome to Camp Bow Wow in Waukesha, the premier doggy day and overnight camp where a dog can be a dog. Our campers play all day in our 4 large indoor and 4 outdoor play yards. Watch your pup from anywhere in the world on our high-speed camper cams. Our certified camp counselors, spacious cabins with comfy cots, pup pools, and outdoor play equipment ensure that your pup has a great time. We're open 365 days per year for your convenience. Stop in for a tour and book a reservation for your dog's free day of camp. Visit campbowwow.com/Waukesha or call 262-547-WOOF for more information.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 262-547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
The Humane Animal Welfare Society of Waukesha is so much more than a shelter. Our adoption staff, animal caregivers, and behavior department ensure the best possible adoptive companion. Our spay-neuter programs actively combat pet overpopulation in our area, and our animal rescue team safely returns lost pets back home. PAWS does one-on-one consultations, holds a variety of training classes and seminars, and even hosts camps for kids. Our shelter is and always has been open admissions and full service, providing resources for pets and their people for a happy lifetime together. PAWS, we're building a society that's humane.
Boarding, grooming, training, and more. When it comes to your pet, Animal Motel is their home away from home. At Animal Motel, we offer a top-of-the-line facility with boarding suites for both dogs and cats, outdoor play yards, a training hall, and so much more. Whether they're here for obedience training, grooming, or an extended stay, we promise your dog and cat will be part of our family. Animal Motel, personalized care for your precious pets.
Looking to get some training for your dog? For Pet's Sake is your one-stop dog training center. We offer all-inclusive obedience training, canine sports training, specialty classes, and more. We provide training classes in 3 convenient locations with our main facility in Mugwanago, which boasts a fully matted 5,200 square foot training hall. While in Mugwanago, check out our Bichon Buddy Rescue and take home your new pet. Bichon and Little Buddies Rescue takes in Bichons, other small dog breeds, and cats that need to be rehomed for various reasons.
Oh my goodness, there was no other choice for me as far as I could see in my future. When I was 10 years old, I decided that for some reason I loved all animals. My mother found me out and about picking up birds that were hurt in a field nearby our house. My aunt owned a dog that I was in love with. They just knew that this is what I wanted to do, and I made it known to everybody. And then finally, at 11 years of age, my dad got our first dog, and then it was there was nothing that could have changed my mind at that point. And from that time on, we had no school in Wisconsin. So my dad would show me clippings every year on, they're going to make a vet school this year, next year, Everyone knew it was very difficult because in the 70s when I was growing up, the veterinary field was all men. So it was no women. So you were actually told, don't go into veterinary medicine, you will never be a vet. So I was steered away from it. I came back again and I said, nope, that's not going to change my feelings as far as I'm going to go for it. I don't care what anybody says. All right, so what's going on with this little doggy?
So this is Mika. She is an 11-year-old terrier mix. She's also intact. So the owners noted about a week ago that she started becoming lethargic and not wanting to eat. They had been trying to kind of treat her conservatively, changing her diet, trying to encourage water intake, all of that. But just a couple days ago, she just became too lethargic to really keep at home, so they brought her to the veterinarian, who took some radiographs. And on the radiographs, they're kind of hard to tell, but it's just a very full abdomen. And some sort of mass effect going on that's really pushing the colon in a way that it shouldn't be. So kind of with her signs, with her age, the fact that she's intact leads us down a route that she might have something called a pyometra. So a pyometra is basically a uterus infection. These guys, when you don't spay and neuter your animals, things like this can happen, especially after dogs go through their first few heats. The incident of pyometra just skyrockets, and especially at 11, if she's been going through heat upon heat upon heat, you get a lot more likely that they're going to have some sort of infection going on. So right now we're going to get an ultrasound. We'll see exactly where that mass effect is coming from. If it is the uterus, it's definitely something that what we do is we actually take out the uterus, so we spay them. It's the best way to fix these little guys, and then hopefully she should be good to go. If it's not the uterus, at least the ultrasound lets us determine that.
Okay. That's the liver. So we look down by the bladder, that's the urinary bladder, and then we look on both sides of the urinary bladder. So that's probably pus inside the uterus right here. And so she's got a pyometra, most likely. But I think we've got to explore, obviously, is the best way to go. They want to save their doggy. But the problem is if it's ruptured or not.
Sure.
That's what I'm concerned about.
Okay.
All right. All right, take it easy.
All right.
I think
You don't want us to touch it. Yep.
So, as a woman growing up in those days, it was very difficult because you were told, don't be a veterinarian. You can't be a veterinarian. This is a man's job. Why would you even consider it? And I just didn't give up the struggle. I said to myself, this is what I want to be, and I don't care no one's going to stop me. There is no way, I don't care how long it takes me. So for me, I had made the decision when I didn't get into vet school in Minnesota, which took about 10 Wisconsin graduates out of 500 applicants. So you had to be a straight A student, and I was a B student. And so they took my application basically and shredded it the minute they saw it, because I wasn't even on their list. So I decided, I worked at an animal hospital in Mequon, and one of the doctors there was he was an Indian vet, graduated in India, and I worked with him for years and years in Mequon. And he suggested to me, why don't you apply to India? And I said, okay. And when I got in, I received a letter saying, hey, you've been accepted to Punjab Agriculture University. I said, I'm going to do it. And I went there, and I ended up spending 8 years in India because of the fact that it was first year I was very, very sick, in the hospital, in and out for every other week. Then the second year I came back again, then the veterinary students were on strike. Then my classes got deleted, and so it ended up being 8 years I was in India, but I came back, got my degree, and then went on from there, and nobody could stop me after that.
This morning we are getting ready for a surgery on a guinea pig named Sunflower. She has some labor issues. She's pregnant and not having the babies, and this condition is something we call dystocia. So we are going to do a cesarean section just like they do in humans and other animals. We can do them on guinea pigs as well.
So I think there's like 3 babies in here. We don't know if they're alive.
Here's a baby. Here's a baby. And here's a baby. I hope the babies are alive. Now I'm making my incision right here, and we don't want to hit the baby. And we're going to melt those babies out. Okay? There's one baby. Oh, these babies will be anesthetized too. So.
Okay, here you go. Give it to me. Just drop it. Yep, got it.
And baby number 2.
No.
There. There's the baby. There's the other baby. Alright, now we are going to spay.
Forced oxygen, okay? And get another dry cloth. Yeah. Keep rubbing them too. I'm gonna get something to tie off the umbilical cord. It came out. Oh, this is so cool. Oh, this is so cool. Yeah, both of them are breathing. This one's a little bit less. And we're gonna tie off the umbilical cord now. So. Is that too close?
That's her.
Okay.
That's her.
this one's, keep rubbing them. Okay. They're both alive.
Here you go.
The babies are alive.
It's just amazing, but look at this little baby. Is this one doing well? Mm-hmm. She's breathing. Oh, you're so cute. You are so cute. The two different colors of the faces. Look at these guys. Oh yeah, they're doing well. So I'm going to get a little incubator for them and put them in heat support. Hi babies, here's your mom. Here's your mom. Guinea pig's gestation period is about 68 days. And then the babies come out precocious, meaning they have fully furred and they have their eyes open. And the reason for that is they actually only nurse for about 5 to 7 days, and then out in the wild they're kind of ready to go and fend for themselves. So this owner was unaware that this guinea pig had even mated with the male until she kind of noticed that the female was getting bigger and bigger, and then she realized, oh my goodness, she must be pregnant. And brought her in last night. She was very sick when she came in here, hadn't eaten, and was very bloated, of course, with 2 babies inside. And because she had mated after 4 months of age, her pubis had fused and she wasn't able to produce the pups by herself. So little baby guinea pigs are called pups when they're born. And there's no way these big guinea pigs would have passed through her pubis because the bone had fused. So we had to do, it's called dystocia, meaning difficulty in ability to produce their babies. So we had to go in and do a C-section on her. And I was actually very pleasantly surprised that we were able to bring out the babies and bring them around. They were a little bit not breathing really well when we first took them out, but very, very surprised that we were able to revive them. And now represent the mother with the babies, and then we'll help her nurse in a little bit. And as you see, everybody loves babies. So now it's good that she's spayed because you don't have to worry about that anymore, but these guys are 1 day old little babies.
I probably thought I just went to sleep and I woke up and
yeah, exactly. And what are these things here?
Things bothering me.
But they're super active, so, yes. And they take their syringe feedings very well. And they're urinating and defecating, so.
And he said to kind of just like wipe them on the bottoms too.
Yeah, they've been going by themselves, though, so I don't think you have to do that. These guys are, you know, precocious, so they're like all set for the world the day after they come out, so.
I knew she was pregnant. She was very large, but she started spotting blood in her cage. And I just didn't think that was right. She wouldn't eat, and that was very much unlike her. So when I took that into account, I figured I needed to take her to a vet. I'm very thankful to them because Sunflower's alive and her babies are alive.
Because you love him completely, because he is part of your family. When your pet needs emergency care, you want the very best trauma and critical care specialist standing by. You know there's only one place you can trust and always count on.
I thank MECA and Dr. DACVECC for the medical care for Bailey.
Dr. Crescent and I are very happy that we were able to provide medical care for Bailey and all the other Milwaukee Brewer player pets.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 262-547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
For over a decade, Fetch magazine has examined the unique bond humans have with their canine companions by publishing popular dog-related topics. With a strong commitment to dogs in need, Fetch also prints local adoptables in each issue, supplies affordable advertising to businesses, and gives rescues 30% off of ads. This year, Fetch is offering $15 subscriptions for your convenience. For more information, visit www.fetchmag.com or pick up your free copy at a local pet establishment near you. Go Fetch!
So this is Quinella. Quinella had a lot of injuries after getting hit by not one car, but actually 2 cars. She had injuries in her lungs. She had some air, which is called a pneumothorax, and then she had multiple wounds on her skin and back of the body. Just kind of, you can see right there on the leg, there's what's called a drain. If you take a look here, we can see that there's a lot of black between the heart and the thoracic wall here. We stuck a needle in the chest and pulled out quite a bit of air. So you can see that the heart is back on the ventral thoracic wall. And here's another image of the hips, and you can see that this hip here is not in the socket where it should be. This is the femoral head. This is what's called the acetabulum, and this should be in here just like it should look like this. So you can see the difference between the VD pelvis from before and then after. We have that back in. So this is why she needs to stay calm and still. We'll keep her here in hospital for the next few days. So you can see we're getting Quinella up. She's actually able to stand on the back legs and on the left front. The right front probably has a little bit of nerve damage of the radial nerve, which is why she's knuckling over a little bit. So you can see there's another drain right here. Here's a wound, here's a wound. And then there's one back here. So she was really injured by these 2 vehicles that hit her.
Today's show was brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.